Hello and welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and give you the tools to take control of your healing journey. If you're living with persistent concussion symptoms, we see you. We know the frustration, the confusion, and the feeling of being stuck in a world that just doesn't understand. This podcast is here to hopefully change that. Each episode, we dive into real questions from real members of the Concussion Fix Program, an online recovery program that has helped over 3,000 people find clarity and relief since we launched in 2020. With an average symptom reduction of nearly 50% within the first 2 to 3 weeks of joining, the Concussion Fix has empowered thousands to reclaim their lives. And if you need a little extra help on your journey, we invite you to check out the Concussion Fix Program. In every session, you'll hear from our expert team. Myself, Dr. Cameron Marshall, founder of Complete Concussions and a leading concussion researcher with over a dozen peer-reviewed publications. You'll also hear from Dr. Paul Herkel, a naturopathic doctor specializing in concussion recovery, chronic pain, and neuroinflammatory conditions. And you'll also hear from Melinda Crinan-Hill, a psychotherapist focused on mindfulness, chronic pain, and concussion care. These episodes are recordings from our live interactive Q&A sessions with real Concussion Fix members, where no question is too small and every story matters. To protect the privacy of participants, all names and personal details have been kept confidential. Now, before we dive in, please remember that the information shared in this podcast is for educational purposes only. It's not intended to replace personalized medical advice. We encourage you to consult with your healthcare provider for guidance specific to your case. So, whether you're looking for answers, hope, or just a little encouragement, we're here for you. You are not alone. Recovery is possible, and it starts right here.
So my question is about inflammation and also like previous, maybe like diagnoses that are related to inflammation and like how that affects the recovery. So just like very briefly, like since 2019, I've been diagnosed with endometriosis, and like shortly after that, I was diagnosed with ulcerative colitis. I had a colonoscopy last April, and my ulcerative colitis is like healed. Like the membrane of my colon is like healed, so I think that's good. But like the endometriosis is like, I don't know. There's not much. They just like take some hormones, and that's kind of the advice. So I have those pre-existing conditions. So like I am on the concussion fix diet. Obviously, like during the Christmas break, I kind of, fell off the bandwagon, but I had done it for about like 2 months prior to that. And I didn't necessarily notice like an increase of symptoms like during the holiday season. Obviously the stomach is not doing great because you're eating like more fatty foods and like more sugar. So like I'm not doing that anymore, obviously. So like, is it just like that, Christmas food stuff that's like, okay, your stomach, but I didn't get a flare of like my other symptoms. And I guess my question is more like, what can I do since I have, from what I understand, pre-existing illnesses that are inflammatory?
Mm-hmm.
And like, I do understand that like the diet will help the overall the inflammation. So it's not just like the brain, but like, everything. So like, is there something specific, some advice that you would give? Like, is there some major impact, like, because I have these pre-existing illnesses, like, I'm going to be stuck with, like, persistent symptoms or, like...
I think I understand your question. Thank you for sharing. So generally, pre-existing inflammation is a risk factor for any sort of trauma to flare that up.
Mm-hmm.
So, for example, if a person has an autoimmune condition, could be in your case ulcerative colitis, a person sustains a concussion or a motor vehicle accident or whatever it might be. It could even be a mental emotional trauma as well. Not to be physical. There's a chance that the underlying inflammation could also be exacerbated, which is a fancy way of saying getting worse.
Mm-hmm.
On the flip side, also, that when you have autoimmune conditions, a person just is more predisposed to inflammation in general. And so that could also be contributing to symptoms that are in the PCS, persistent concussion symptom category.
Mm-hmm.
It doesn't mean you can't heal. It just
Mm-hmm.
means that you have to pay more attention.
Mm-hmm.
A good analogy would be to say that if a person's had a injury to a ligament previously, like I had a knee damage done, if you're going to get injured again, most likely
Mm-hmm.
the knee is predisposed to get injured again because those areas have that predisposition.
Mm-hmm.
What my suggestion to you is that making sure that all those existing conditions are as proactively treated as
Mm-hmm.
possible, to keep those things in check, to not muddy the water with the PCS
Mm-hmm.
symptoms. I'll give you an example from what you've just shared. The
Mm-hmm.
ulcerative colitis is an inflammatory condition of the gut, of the lower intestines. And anybody that has any sort of gut, especially autoimmune conditions, you're going to have issues with certain foods that might be aggravating to it. You might have issues with intestinal permeability,
Mm-hmm.
uh, and you might be more predisposed to, if you do eat more refined foods or do eat your triggers,
Mm-hmm.
then those symptoms might come back, or maybe a mild version of it. Some of the symptoms you might have described that you got over the holidays after just kind of falling off the diet. So the concussion fix diet is the baseline here, meaning that it's what everyone should be kind of eating, but there may be some additional investigation and work that you might have to do to identify, okay, maybe we need to look at some more specific food sensitivities, like what foods did I eat over the holidays that triggered it? Is it just refined sugars? Because that is just an aggravator for everything, but
Mm-hmm.
it could have been dairy products, it could have been wheat products, it could be more alcohol. There's a whole host of things
Mm-hmm.
that you could be sensitive to.
Mm-hmm.
So it's the message is that we want to be more proactive. Inflammation is additive. It can be caused by past conditions, but it doesn't mean that you can't heal from that. I just
Mm-hmm.
would encourage you to really look at it. Just look at everything with even more kind of commitment
Mm-hmm.
and work with that healthcare provider, like a naturopathic doctor or functional medicine doctor, to say, okay, I have these predispositions. How can I keep these inflammatory pathways in check that now I'm dealing with in PCS?
Mm-hmm. And do you know or have any recommendations for naturopathic doctors in the greater Montreal area? Because it's kind of, I guess, a field that's sometimes,
Yeah,
how do you say,
well,
like exploited in a, so like it's
it
hard
is.
to trust, somebody. And in the past, like my ulcerative colitis, I am taking medication. I am careful of what I eat, and I I've been in remission now for a while, so that's
Amazing.
okay. But the endometriosis is a bit of a more difficult one, in which the treatment for doctors is hormonal, therapy, which I've attempted in the past and felt absolutely horrible. Um, so I'm kind of like not wanting to do that, but then I wonder, like, do you have? Well, it's kind of a medical advice, so I don't know what you can say on that. But like, is it something that if I take it, like, my inflammation will go away, or is it just something that's like to treat pain? Like, I don't know. Like,
Yeah, so I mean, we have to be careful with endometriosis. There's inflammatory components, but
mm,
doesn't mean that it's not inflammatory in the same way that ulcerative colitis is, or
mm-hmm,
even in the same way that a concussion is.
mm-hmm,
Certain self-limiting inflammatory pathways that happen in the brain and in other tissues in the body after a concussion and or whiplash.
mm-hmm,
So those things can still be addressed. Uh, I think that probably, to answer your first question, because of the multifaceted, different medications you're taking on for that you've tried in the past, you're taking for the ulcerative colitis, maybe just message me on the group, and I can
okay,
guide you on where to find that additional help. It could be somebody locally, it could be somebody in Ontario because you're so close.
okay,
Because in Quebec, naturopathic medicine is not regulated, unfortunately, very well, as you said.
yeah,
So it's really hit and miss. Some good ones, but there's some really duds too.
okay, okay. Thank you. Um, And just one last question. In the previous question, you spoke about magnesium, and I kind of heard, and I don't know like what's the truth behind it or not, but like in taking certain supplements, like if you have an excess of those supplements, there's like a negative side effect. And like I was just wondering if magnesium is one of those, or is it something like
Mhm.
kind of safe to take if you're not doing any like blood work
Right.
follow-ups? Yeah.
Did you get to to that section in the course yet, Lauren, when we talked about supplements?
No.
Okay, so I do answer that there. So
Okay.
work your way through the course and get that. You're going to get a
Okay.
more complete answer there. But the short answer is that magnesium is one of the few supplements that really there's no good test for, and most people
Okay.
are deficient, and it's very well tolerated. So those three main reasons is why
Okay.
it's one of the most commonly prescribed supplements in my practice, and it's one of the most popular ones that are used by most people because it's just very safe and well tolerated, and there's a lot of reason to take it. So that's not me
Okay.
giving you advice. You'll learn more about it in the course,
Okay.
but yeah, that magnesium is a pretty safe one.
Okay. And just last question. When you said message you in the group, you mean on the forum?
Yeah,
Like,
on the forums. Yeah,
okay.
there's you can direct message and I'll send you some links there.
Okay. Thank you. Thanks so much.
You're welcome. Thanks for asking. All right.
So I just wanted to ask. Well, yeah, in terms of the exercise, and well, so maybe let me start with manual therapy. So because I get a lot of like muscle tension and also tiredness. Um, so I'm just not sure what's the best way to approach this. I'm going to chiropractor. I mean, originally, I think I messaged you. I had like an anxiety after the first chiropractic appointment. So I was wondering if this is for me or not. But yeah, I noticed positive like mobility changes in my spine. So now I'm going to chiropractor 2 times, and I'm getting addicted to it a little bit. Um, but it also makes me a little bit tired. I mean, every time like I go, it's maybe a little bit less and not so much as when I started, but still I get a little bit of like tiredness after the adjustments. So I was just wondering like how to tackle that with the exercise. Um, and I don't know, maybe it's also because there was December, and I think normally it's very like tiring month for me and probably for everybody. And yeah, but I just noticed that I'm like getting quite tired, especially after the exercise. So I was just wondering, is it better like let's say if I have a chiropractic appointment, and then is it good to do the appointment the exercise on that day, or it's better to skip it, for example, and do it the next day? So that's maybe my first question. And then the second question, if I do exercise like on one day, I see that next day I'm a little bit more like tired and I get muscle tension after the exercise. So is it good to basically push through this tiredness and exercise the following day, or give it a day break and exercise every other day?
You can do it on the same day. There's nothing wrong with that. And I think that if you just do that and get into that routine, I mean that will help with the fatigue as well. You'll get more energy from
Mm-hmm.
starting to improve your exercise tolerance. But also if you have an appointment on a day, I would do your exercise before the appointment so that you're not
Mm-hmm.
struggling through the exercise after the appointment. Now, the fatigue that comes from treatment, sometimes that's, related to, inflammation from somebody working on your muscles. It also is related a lot of times to kind of anxiety or like a sympathetic response. So that if you're going in there a little bit nervous about getting treated and then they treat you, that can kind of send your body into a bit of a fight flight, and that can just kind of wear you out, right? So if you're kind of in that heightened state of arousal, it's going to just be fatiguing. So, try working on some strategies while you're doing the appointment, before you're doing the appointment, and maybe doing some exercise before the appointment would actually be helpful because you'll able to warm up the tissues. They tend to respond better when they're warmer. It also exercise is, relaxing, and it helps to increase your parasympathetic side. So it helps to reduce stress. And so, maybe that's a routine. Try that. Try exercising prior to the appointment, and try doing
Mm-hmm.
things, during, before, and after to try and just keep your sympathetic nervous system from activating. Uh, and then obviously continue working on all the other pieces like diet, autonomic, mindfulness, all those things to try and keep things balanced.
Okay. And also, like, are the chiropractic appointments, is the chiropractic care enough? Or because I think you mentioned about that, like, there should be like soft tissue and, for example, the joints, and like that you have to approach it like holistically. So I'm just wondering, because I'm doing now only the chiropractic care. So I'm just wondering, like, am I missing something? Like, should I add something into this kind
Well,
of
I don't know what
treatment?
I don't know what they're doing, right? Chiropractic is just a professional title, right? So like that's like saying is doctor enough, right? Well, what is the
Okay.
doctor
Well, they do just
doing?
like
Like
bone.
it's the
Yeah,
same
I
thing,
mean, they
right?
do just like the kind of adjustments. I mean, it takes like, I don't know, maybe 5-10 minutes
Yeah.
sometimes.
No, that's not what you're looking for.
Okay.
So soft tissue is
So.
probably more important than the adjustments. Right.
Mm-hmm.
So anyone who's just doing adjustments, sometimes that will help to relax soft tissues, but ideally you want to do the soft tissue work before you do the adjustments anyway. So like I typically will do soft tissue, acupuncture, get things loosened up and moving well. And then if there are
Mm-hmm.
any things that I can adjust, I'll look and be like, okay, maybe I'll do an adjustment here or there. But I have a lot of patients that I don't adjust at all because the soft tissue is really the most important piece anyway. So if they're only doing adjustments,
Mm-hmm.
that may not be sufficient. So you may want to, overlay that with something else. If you have a physio that does manual or a massage therapist, you can kind of alternate between the two, so that
Mm-hmm.
you're getting both pieces.
Yeah. No, I'm just wondering. I mean, in the Netherlands, we have something called manual therapy, but I think we are kind of getting lost in translation, because I think what manual therapy means in like Canada is something different than what is manual therapy in the Netherlands. So I'm just a little bit lost. Like, what should it be if like the
Go
chiropractic is doing the
go look
adjustment?
go look at the 2 videos I did. Go to the resources portal.
Mm-hmm.
Go to my live presentations and look up. I have a manual therapy part 1 and a manual therapy part 2. Watch
Mm-hmm.
both of those, and I actually go through like me treating somebody where you can actually see what are you doing, and you
Yeah.
look at that,
Yeah, I
and then you
watched that.
say, "Am
I
I
just.
getting that or not?"
Okay. Yeah. So, what are some of the questions? Because I saw that video. It's just I don't know how to find the right specialist that would do that. So, are there maybe some questions that I could ask them, or like just
You
I
could
don't know,
ask them.
because it's.
You could ask them
Mhm.
if they do soft tissue work, right? Do you work
Mhm.
on the muscles or do you just do adjustments?
Mhm.
You could, a lot of times you have to go in and maybe try it and talk to them and be like, is this
Mhm.
really, is this what I'm looking for or not? I don't know if there's many people that are certified in active release over there, but you can
Mhm.
go to the active
I
release,
haven't seen.
go
Mhm.
to the activerelease.com website and see if you can find any trained providers. That might give you a clue. Uh,
Mhm.
so
Yeah,
yeah,
I saw
it's tough.
osteopaths. There's a number of osteopaths that have like some treatments for whiplash or
Sure,
sometimes concussion. Would
sure.
that be perhaps more
Yeah, a
suitable
lot
for
of this
me?
stuff this is the most challenging thing because a lot of this stuff is just trial and error. So
Mm-hmm.
we try to point you in the right direction. So if you go and watch those videos and be like, okay, this is kind of what I'm looking for, and
Mm-hmm.
then start looking around, asking other people if maybe try osteopathy, okay, they're not doing the thing I need, so I'm going to try this, manual therapy person. They're not doing that either. Maybe I'll try massage. Oh, this is pretty good. Okay, I'll stick with massage, and also maybe I have some joint issues. I'll do chiro and massage. It's really just trying to figure out who is gonna help you, and there's no real kind of set parameter for that. Like if you look on their website, look for people that treat headache disorders, right?
Mm-hmm.
Because that generally means they're pretty proficient with necks. Go to the activerelease.com website and see if you can find a provider in your area, and then look at their website. Do they treat headache disorders? It's a lot of trial and error, but if you look at those
Mm-hmm.
videos again, just kind of rewatch them and be like, okay, this is what I'm looking for, this type of
Mm-hmm.
thing. it doesn't have to be exactly what I do. Like I'm going to have a different style than different people. And it doesn't mean that those other styles don't work. But you just want to have somebody who does soft tissue as well as adjustments. And if you can't find that, find somebody who does massage and soft tissue, and then find somebody who does the adjustments, and you just alternate between the two.
Okay. So for now, would you say it's better to stop with the chiropractic? Because it kind of makes me feel good as well.
Great.
But I'm just thinking maybe, I should add
No,
something.
don't stop. No, don't stop, but just find a massage therapist to do the soft tissue work so that you're getting both.
Two.
Yeah.
Okay.
Yeah.
Okay, I will do that. I will look for somebody. And just to finalize on this tiredness, like, is tiredness a normal part of concussion and that goes away with time or with exercise or with, I don't know.
Yeah. So fatigue can be related to a whole bunch of different things. Right? So you can't just say like, is tiredness related to the concussion or not? Because tiredness could be related to autonomic dysregulation, like I mentioned. It could be related to inflammation. It could be related to hormone issues. It could be related to sleep dysfunction. It could be related to even people with neck dysfunction have increased fatigue levels and poor sleeping. So it could be related to your neck. So getting the neck treatment may help with that over time too. So you kind of have to do all the things. That's why. But if you're doing all those things and you've balanced your autonomics and your inflammation is low and you're exercising regularly and you're sleeping well and you're getting your neck treated, all of that will fall into place. Right. So we don't typically go after symptoms in this program. Like it's not like, okay, fatigue, you need to do this one thing, because all the symptoms overlap with every single one of those categories. So it's impossible to try and pinpoint which one of those categories is your issue. That's why we address it in that stepwise way, and we make sure we're addressing all the underlying potential causes for any of the concussion symptoms. And as those things get better, those symptoms will improve.
Fatigue is such a huge part of mental health challenges and anxiety and depression or stress. Fatigue really is a huge part of that. So right at that foundational component of our Concussion Fix pyramid is looking after our mindset and our mental health and our well-being, right? When we're anxious all the time, our body's tired because we're in a constant state of fight or flight. We're in that constant sympathetic activation, right? Our nervous system is dysregulated. So that's even that foundational one that can contribute to fatigue, and alongside everything else Dr. Cam mentioned. So kind of delineating for yourself, hey, what could this be? Is there some value in going back to some of these modules more at the beginning of the program to help support? Or maybe you can point it yourself, right? And recognize, fatigue is also part of getting an adjustment if you get that fatigue afterwards. Like Dr. Cam said, it does activate your sympathetic nervous system, so it can generate fatigue afterwards. So it is a bit of a puzzle. Not always clear.
Yeah, exactly. Okay, thanks a lot. I think that answers my question.
Good luck.
Yeah.
Thank you.
Keep peeling the layers, and hopefully we'll continue to find what's driving that fatigue. But overall, it's a combination of multiple things in our experience usually.
Okay. Yeah. Thanks.
All right, let's go to a question in the chat. So one was directly messaged to me. It's for Dr. Herkel. Dr. Herkel, can you talk about organ meat? I'm premenopausal, had blood work done, and my estrogen is starting to go down a bit. Progesterone wasn't tested, as I assume my doctor forgot to mark it down. My naturopath assumes that my progesterone is also off a bit. Just the very start of premenopause. Have been hearing about organ meat lately. It's beneficial for the stage of my life, acne, energy, all kinds of things. Have you heard of the benefits? Any supplements that you recommend? As I can't eat organ meat itself, I have tried in the past and not enough sauce can make it palatable for me.
So organ meats in general are going to be some of the richest sources of nutrients, specifically a number of vitamins that you really can't find anywhere else. Number one, your B vitamins are in the highest kind of concentration in organ meats. There's some in also red meat, like for example, steak or wild game, but there's no vitamin A, which is the other big one that is found in organ meats. Vitamin A is really important for immune function, any sort of mucosal membrane, which is like, think of your nose, sinuses, throat, and intestinal tract, of course. Vitamin A plays a really key role there. And so that's one of the main benefits of getting those kind of fat soluble vitamins, so vitamin A, vitamin D, and then some of the water soluble vitamins. You can supplement with all of these as well, but organ meats give it to you in a form that your body is able to absorb very easily. The closest form to what we have in our own bodies is going to be the most bioavailable form in almost all cases. A good example was iron deficiency, which is a pretty common thing in middle-aged women. Red meat is the most bioavailable source of iron after organ meats. So iron is a great source in organ meats as well. So there's a big push recently, if you're following social media, if you're following some of the influencers online, are talking about kind of getting food-based sources of nutrients. So I'm a big proponent of that. If you can't stomach that, you can supplement with freeze-dried organ tissue. Liver is the main one we're talking about here. There are other benefits from other organs. I use in my practice something called glandulars, which is extracts of different glands. But honestly, it's too detailed for the conversation here with everyone in part of the Concussion Fix. At this point, that would be the conversation with your own supplement literate provider, naturopathic doctor, to figure out, okay, so what combination of nutrients do you need? Ultimately, we want to be evidence-based here. We want to look at what you're deficient in and actually correct that. I like consuming, high quality, high nutrient dense food, and organ meat is at the top of the list. And so you're kind of using it just as a food base. You're not necessarily using it as a supplement. Those things that you mentioned are like things like hormones. It's going to have kind of a supportive effect, but it's not going to be a game changer, to be perfectly honest. Those types of hormonal deficiencies generally kind of happen gradually, and they do have to be addressed in using botanicals, and even sometimes bioidentical hormone replacement can be considered. Again, you need somebody that's going to guide you through that. So hopefully that gives you kind of an overview. Eating the highest quality red meat, if you can stomach that, is a really good option, but you are not going to be getting the fat soluble vitamins that you would get in organ meats.
Awesome. I have another question here. Could you please address the issue of age with concussion recovery? I've had multiple concussions in the past, but with this one, I'm having more memory problems, which are not improving at 6 months post. I am now over 60, an age that people without concussion develop memory problems, and I'm afraid that the concussion is accelerating this. I know that you feel that concussions are not necessarily related to CTE, but if the concussion happens at a later age, I'm afraid that it could accelerate memory loss. My other symptoms are not resolving this time the way they used to either.
Yeah, so there is evidence that people who, these are usually large, like population-based studies. There was one from Denmark a couple years ago that found that those that had concussions at a later age, like 60, 65 plus, tended to have increased risk of dementia and cognitive decline. It's a slight increase, like it's not like it's guaranteed or anything like that. So yes, there is an increased risk. The other thing to, consider is that a lot of cognitive problems, especially in concussion, and the research supports this across the board, that in the majority of studies, people that complain of cognitive problems after a concussion actually test normal for cognitive function. Because your mind is powerful, if you start to think and believe that you have cognitive problems, you'll start to see more and more evidence of it. Right? So if something were to happen, like you forgot to pick something up at the grocery store, and you come home and you're like, oh man, I meant to get potatoes and I forgot. And then you start blaming concussion. But people have these momentary lapses all the time. That's just kind of part of life. But if you're attaching value to it and you're attaching that kind of emotional component to it where you feel that, oh, this is my brain is damaged because of my concussion, it's going to make it so that anything that happens, you're going to start to feel that happens more and more and more. So across the board, most of the research shows that people that complain of cognitive problems after concussion don't actually have cognitive problems. They test normal. And the people that complain of cognitive problems, that's mostly associated with mental health issues. So anxiety and depression. Those are the two most common ones that are associated with cognitive problems. Because if you are anxious, your mind will be super, super active and you're not able to focus on what you're actually doing because your mind is kind of spinning and it's elsewhere. Right? So we see this in that thing I talk about, which is like default mode interference, right? Your default mode is the internal dialogue inside your mind. And you have the other network, which is your executive network, when you're focused on a task and you're doing something. Those two networks generally should work in opposition to one another, meaning that when your default mode is on, your executive network turns off, and vice versa. So when you're focused on something and you're dialed in, your default mode network, that little internal voice inside your head, shuts off. Now, with concussion injuries, we see activation of both networks at the same time. But what we also see is that in people with anxiety, we see activation of both networks at the same time. So that impacts your ability to focus and concentrate. So the treatment really here is to focus on calming the mind, right? So we want to focus on reducing that rumination, focusing on the kind of mindfulness-based things. But also cognitive function is related to other symptoms too. It's hard to focus and concentrate when you have a headache all the time. It's hard to focus and concentrate when you feel dizzy, right? So I think there's a few things that go on with cognitive impairments. One is if you start worrying about it, you're going to start to see evidence of it everywhere. If you think, oh my God, I have this, it's going to just continue to happen. And that's kind of the relationship to those, like the, suspected CTE cases where people think I've had a number of concussions and now I'm having these cognitive problems. So therefore it must be related. And then they start to see evidence of it everywhere. So that's one facet. The other facet is that if you are in a state of hyperarousal and your mind is super active and worried about things, that's just going to increase your cognitive impairment because you can't focus when your mind is moving a million miles a minute. So we need to bring that down. And also doing the other things in the program to reduce overall symptoms, cognitive function should improve, right? Cognitive function is related to chronic inflammation, right? The new kind of terminology around Alzheimer's disease is diabetes type 3. Right? Because it's just a chronic metabolic inflammatory thing that happens over our lives. So how can we help to mitigate that? We reduce inflammation in our bodies, and that's part of the program as well. So everything in this program is geared up not only to help you recover from the symptoms you're currently experiencing, but also to give you a good starting point for the rest of your life to reduce all the risks of all these other kind of chronic diseases that happen as we age. So yes, there is increased risk if you get a concussion later in life. However, there's a lot of other potential answers or reasons for why you're experiencing this. And number one is going to be kind of the mental health, anxiety, rumination piece. Number two is going to be inflammation. Number three is probably autonomics, right? And reducing that sympathetic drive. So all of those pieces in place should start to improve things. And if you can kind of take a deep breath and kind of calm your mind down a bit, I'm sure that'll help over time. Anything to add from Melinda or Paul?
I think you explained it really well, Cam. Just this sense of how multi-layered it is, but also how important it is to kind of go back to those foundational elements. And I think when anyone reflects on their own experience, they can get a sense of where those issues might be. And if you don't have sort of an intuitive sense, oh, wait, you know what? I am experiencing a lot of anxiety, for example. Maybe that is why my mind is feeling so scattered right now, right? We also see a lot of ADHD, post-traumatic stress. All of these things following concussion, especially if it was a traumatic way that concussion occurred, can create scattered thinking, if we want to call it that, right? This inability to kind of focus and concentrate. So there's so many components to this, and I think Dr. Cam's done a great job of sort of explaining what all those layers are. So my only comment would be, assess for yourself. Is it intuitive to you, where you might be as you've already been through the program? And if not, start at the beginning, right? Start at the beginning of the Concussion Fix program. We'll take you through everything mindset related that will help you be able to understand whether there's any components in your mindset related to this worry about Alzheimer's. It's 100% true, right? The more we think about something, the more likely it is that we start to see it everywhere. It's just the way the mind works. And there's lots of exercises we have in the program right at the start that can help walk you through that. And hopefully you'll get a little bit of a roadmap for yourself to identify, where might this concept be coming from, and where do I need to focus my attention?
Yeah, well said. Nothing to add other than the only thing you can really do is just focus on completing the course. Go ahead and do it right now, because thinking about, is this somehow going to predispose me to dementia or anything along those lines, is unproductive in any way. And even if you were going to go to your doctor to say, oh, listen, I think my concussion's going to predispose me, they have no idea what to do with it. There's no treatment in any space that's going to help you in the conventional side. So the best thing is to work through the modules and address everything that Dr. Cam and Melinda talked about. Well said, guys.
One more thing to add on that is that if you have gone through everything and you've been diligent on the diet, you're reducing your inflammation, your sleep is good, your mental health is good, you're doing all the kind of stuff from Melinda's modules, you don't have any physical pain, like you're not having headaches anymore, you have no more physical symptoms because you've addressed them all with this program, but you're still concerned about the cognitive side and you still are feeling that you have issues, then that's when I would suggest you actually try to book in with a neuropsychologist and have a full cognitive assessment done to see, do I actually have cognitive problems or not? Now, the thing is, if you have headaches, then your neurocognitive assessment is going to be abnormal, right? So I would try to address all those other facets first so that everything else is good. And then you go and say, okay, the last remaining piece seems to be this cognitive issue. Then you go and actually get it tested. Is there something there or not? And that can just give you a little bit of peace of mind if there's nothing there. Or if there is something there, they can give you some strategies and cognitive rehab exercises to work on those pieces. But the first step is still building that foundation and making sure you've addressed all the other underlying issues, like the inflammatory, the mental health, the autonomic, the physical symptoms, the headaches, the dizziness, whatever else. If all of that goes away, generally cognitive function goes back to normal. However, if it's still remaining, then you want to get a either I think an occupational therapist can do it as well, but a neuropsych is really where you want to go.
All right, let's go back to live.
Best wishes from the Netherlands. I really love the program. It's really helping me out. I'm on now since October. I have a bit of a puzzle going on because of my eyes and the neck. I'm halfway the neck videos now. The thing is, I made a fall during an expedition in September 2023, and I fell forward on the ice. We crossed the ice cap in Greenland. It was on the last day. A few hours later, we finished, and I only had a sore shoulder, and weeks later, they found out that I had a concussion. What I forgot about is that before I fell forward, I also fell backwards because the sleigh was hitting my knees, and then my head all the way got how do you say, backwards to my back, and I fell on the sleigh. So I only said ow, and we continued. A half hour later, I fell forward again with the sleigh, and that's when I fell on the right side of my head. I didn't have any headaches. It's just that because of I saw some light flashes of light that a physiotherapist was alarming, and then we found out that there was concussion. The thing is that they put me back to work too soon, and I didn't recover from the concussion, and it ended up in March I was brought to the hospital because I got very dizzy at work and collapsed, and I couldn't move my arms, my legs, and I couldn't even lift my head. So they put me in the hospital for a week and then sent me home and said you will be fine in 2 weeks' time because it's just an infection. Well, I didn't have much progress till I started this program. And now I'm a bit puzzling with the eye section and the dizziness section and the neck section. I do wear prism glasses because I had a frontal calcar lesion in 2009. I had a whiplash then, The prism is tested twice now, in April and November, and it's not stable anymore. So the guy says, I'm not giving you new glasses because first it has to be stable before we do that. The first question is, do I do the eye exercises with or without the glasses? And the next question is, in the next session, Dr. Kem says something about sometimes you first work on the neck and then you do the eye exercises. So the question is, should I start with the neck and then do the eye exercises, or do I continue with the eye exercises? I have done some of them somewhere in June with a physiotherapist, and then we had to stop them because it made me really, really tired, and I couldn't even walk for 100 meters. So I'm doing them. I started them again a couple of weeks ago, and I'm working with the eye stuff, but now I'm on the next session, and I'm wondering what should I do first. So that's the two questions.
So the reason, are you getting neck treatment right now at all or no?
Not anymore, because when we tried that, the physiotherapist, I have now tried it, and then I got really dizzy for 2 weeks. So he is a bit careful now.
That's a perfect reason to do more. That's where people go wrong, right? Because it's like, if you're getting neck treatment and that's making your symptoms worse, it means that your neck is probably involved, and avoiding treatment isn't going to make it any better. It's still there, right? So you have to kind of work through. Sometimes you have to get a little bit worse before you start getting better. So I wouldn't avoid it. I would actually push into it. That's one you want to kind of push into. Now, the issue with the eyes is that the eye motion and how your eyes function is extremely related to your neck. So the reason I suggest you generally, for most people, do neck stuff first is because if you're doing eye exercises, every time you move your eyes, it engages your neck. And if you have neck dysfunction, eye exercises are going to just make your neck tighter and tighter, and you're going to hit a roadblock where things aren't working, right? Your prisms are unstable, probably because it's not the eyes, it's your neck. And so that's why you're getting all this variation, because day one, your neck might be looser than day two. And so the things are going to look different on your exam. So that's why if you fix the neck first, in most cases, the eye problems will resolve. And if they don't, now you can do eye exercises that are for the remaining actual visual problems. Whereas if you have neck dysfunction, you're doing eye exercises, that's generally just going to flare your neck up, and you're going to have increased symptoms with that, and it's going to just be related more to the neck. So for most people, if you can do them simultaneously, that's great, because they kind of work in tandem and build on each other. If you want to pick one, then I would always start with neck first. And then once the neck is good, then you can go and do the eye stuff.
Okay. Yeah, that's exactly what happened last week. That then my neck got stiffer and stiffer, and then that's why and then I saw this video and I thought, okay, I have to ask that question. Yeah. So we should continue with the neck. Yeah, the physiotherapist wasn't so sure when it happened, and I got so dizzy. He wasn't so sure to continue with the neck, but I'll speak with him about it, and we'll see what.
Yeah, like when I see a patient, for example, my explanation before I do anything is, just so you're aware, when I treat your neck, this may flare you up. Your headaches may be worse for a few days. Your dizziness may be worse for a few days, but that's a good sign, because it just tells us that your neck is definitely involved in this situation. Now, in, about half of my patients, also you feel really, really good after. Your headaches are gone and your dizziness is gone. Like, I'm treating somebody right now, and they're having lingering dizziness issues from like a viral infection. So it's not concussion, but it's a viral infection. But when you're dizzy, your neck tightens up. So now when your neck tightens up, it causes kind of lingering dizziness. So the viral infection is gone, the vestibular function is fine, but now it's just the remaining dizziness from the neck. And I said, I might flare you up when I treat you. So just be aware of that. This is not really cause for concern. You may get dizzy, you may have headaches. And I treated her, and she came back. She's like, I felt great all week. Like, this was amazing. So some people, you're going to feel really good right after. Some people are going to get flared up. So you may just be one of those people that gets flared up. And that's okay, because every time you treat it, the flare-ups are going to be less and less. And after a few treatments, they won't happen at all. And you're going to feel good after those treatments. But if you stop, you're basically just going back to square one, and you have to start the whole process over again.
The other component too to think about is some people stop because they become really afraid of the symptom that shows up following a neck treatment. So if you get dizzy, right, dizziness can be a really frightening experience for a lot of people. So if you get dizzy afterwards and suddenly you're like, I don't want to do this again, right? Our sympathetic nervous system's now activated. We're feeling a lot more tightness in the body. We're getting anxious, worried, we're probably catastrophizing a little bit about what that could mean for your future. So all of these components are important to think about too. So what is the reason that you're not going back? Is it partially maybe anxiety or worry or fear about what could happen if you keep getting this symptom? If so, maybe work with your provider and say, hey, I'm actually really fearful of this symptom. Can we ease off a little bit and do things in smaller chunks so that I can build confidence that even if I flare up, I'm still moving forward, versus, having them go really deep in there and then you're flared up for 2 weeks and now you're spiraling with that anxiety component. So it's important to find this balance between the actual physical treatment itself and how you feel mentally about what's happening. So we've talked about this before in other lives about feeling safe with your provider. So having that communication with your provider, just the way Dr. Cam said with his current patient, he tells them, hey, when I do this, it might flare you up. What you've done there is build trust with your client that they know what might happen in their bodies following a treatment that you've done. So now there's this baseline of trust that, hey, this is going to be okay. I'm now prepared of what might happen to me. And having that communication, that open communication with your provider can help you build trust for your own experience on how you're going to feel afterwards and to bring down that fear response of the symptom that it might provoke. So I would invite you to really openly communicate with your provider what's happening and how you're feeling about the symptom, and see if he or she can work with you regarding the intensity of the treatments so that you can work together to build up that strength, right? So to recap, having symptom flares isn't dangerous. It's probably helpful because you're working in the right areas and your body's realigning. I don't know if that's the right words. Dr. Cam might correct me. But number 2 is this sense of allowing yourself to build safety in the body, safety with your provider. Having that proper connection is going to help support you to not feel anxious and overwhelmed, and it will help keep your nervous system regulated for a treatment that you hope to be beneficial. So if our nervous system is regulated, we're probably going to feel a whole lot better about receiving a treatment that might flare up our symptoms.
Yeah, thanks for that, because that's exactly what happened in September. And after that, I started this program. So I know better now what happened at that point. The point is more that he is getting insecure working about with my neck, so he's doing other stuff now first. And maybe I am ready to be worked on my neck. That's what I get out of this conversation. So that will be fun to go to him in a week and speak about it. Yeah, I'm confident that the things will get right. That's okay.
Right, and that's so interesting too, because if your provider's getting insecure, should I be treating your neck? What's that signal to your body? This is unsafe. I shouldn't do it. My symptom flare-up's probably going to last a whole lot longer every time I get treated because my provider is uncertain. So there's sort of these subtleties happening there that are really important to address and just openly communicate. Hey, if you're feeling, unsure about treating my neck, then I feel unsure about you treating my neck, and I think my symptoms flare more.
Yeah, thanks for that. And do I do the exercises, the eye exercises, with or without the prism glasses? I don't know if I missed that answer or.
It depends on which exercises they are. I would lean towards trying to do them without for most of them. But also I would focus on the neck first.
Yeah, that's step 1.
Try to figure out, like, if you get good neck work, do you need the prisms at all? Does it completely resolve, right? And so, like, that's really the question.
Yeah, that would be really interesting. Yeah. So that.
Yeah, and you may need to find a different provider, right? If this provider's not comfortable, it says that they probably aren't super experienced with this. So you might just want to look to see if there's somebody else that might be a better fit. But I know it's hard to find this. This is one of the hardest things for us to even recommend because everyone's hands are so different. The training in different countries is different. So it's extremely difficult.
Yeah, it would be nice if we could see all the videos. That would be very helpful.
Yeah.
So,
yeah.
Yeah, we'll see. Thanks for this. This is helpful.
You're welcome. And then maybe we can do some rapid fire chat questions.
Hi, everyone. Happy New Year. So I have a question regarding, well, trying to think of how to say this. So I'm just wondering if something that my eye is doing is an indication that my eyes might be more of an issue, or if it still might be more of a neck issue. So when I'm in vision therapy, which I'm doing vision therapy and also having my neck worked on, but I'm in the process of trying to find a new chiropractor who's really going to dig into some of the soft tissue work. However, when I'm in the vision appointments, the doctor notices that one of my eyes are veering in as I'm trying to focus. Is that an indication that it might be an eye problem over a neck problem, or is that just, I don't know if that's telling me anything at all, but it just kind of popped up as a question that I should maybe ask you guys.
I mean, it's tough to say. Generally, like the eye veering in, there's that seems to be more of a visual problem. But you'd have to kind of do the therapy. Like, are they giving you any exercises to try and fix that?
Yeah.
Yeah.
Mm-hmm.
Yeah. So I would just keep working on that. Try to find the new chiro to work on the neck simultaneously. And I mean, that's really the best bet. Like if you're doing them both simultaneously, they tend to work together. So if you're doing the eye exercises, but you're also working on the neck, you're getting it from both sides. That's your best bet.
Okay. Yeah. Okay, great. I figured there wasn't really a straight answer, but when I have these little insights, I'm like, ooh, let me ask this.
Yeah.
We can rule anything out. Okay. Super helpful.
Yeah.
Thank you.
You're welcome. All right, Nikki, you got some rapid fire for us?
Yeah. And I think you answered a little bit in the last one, but why is having a massage triggering symptoms?
Yeah, so that's a good question. That's usually because your neck is involved in your symptoms. So if you have neck dysfunction that's causing headaches or it's causing some dizziness and you get a massage, you're kind of getting a new neck. And so your brain tries to recalibrate that. And sometimes it flares and sometimes it makes everything go away. So it's generally just a sign that your neck is an issue and you need to just continue getting more work on it.
Great. There's another one here. I'm starting to feel like concussion is like peeling an onion. My back is getting better along with my POTS from daily 30-minute heart rate exercises. Was wondering why my neck kept tightening up right after great treatment. My chiro concussion guy did some eye tests and was shocked that I didn't have constant dizziness and headaches. He's getting me to do figure eights, looking at one point, and I walk like I'm drunk. I was shocked to find how bad this is so far out. He's also getting me to read converting one eye, and anything on the outside of the page is wavy and blurry, and I get headaches immediately. Do you know what this is called and how long it takes to heal this? Could this be permanent after 9 months post-concussion?
It could be neck, it could be visual. So it's hard to say which one, but things like eyes, like things moving on the page is frequently associated with neck dysfunction. Dizziness and doing figure eight turns, that's something we frequently do with concussion patients. And again, that could be all related to neck dysfunction. Why does my neck tighten up right after treatment? It could be a whole variety of things. It could be a sympathetic response like we talked about before. It could be inflammatory. It could just be, your response to the treatment at this time. Is it permanent? I don't think so. I don't think anything with concussion is permanent. It just means there's dysfunction. And so just continue working on those things, continue doing those exercises, and things will improve.
Great. Here's another one. I was sent to a PT to work on my neck a while back. She's
strengthening.
Yeah,
shoulder and range of movement.
Yeah. And stretching. So shoulder, the motion, strengthening, stretching. I do not recall her actually massaging or manipulating my neck. How do I find the correct treatment?
Yeah, so I would go to the manual therapy videos that I did. So if you go to resources, go to my folder, there's manual therapy part 1, part 2. I would have a look through those. PTs in general tend to be more exercise based. Chiros tend to be more manual therapy based. Now, the evidence around neck dysfunction and dizziness and headaches after concussion that are neck related, the evidence is all on manual therapy. Exercises don't work for this. Manual therapy works for this. So when you go to a PT and they're giving you exercises and they're not touching your neck, you're in the wrong place, because the exercises won't do anything. Because if you have dysfunctional movement patterns, meaning that you have tightness in your neck, it's going to change how you move. And so if you're doing exercises, all you're doing is reinforcing a bad movement pattern. It's not going to do anything to help you. So what you need to do is first work those tissues out, get things moving properly, then you start strengthening. So in that manual therapy video series, the 2 videos that I did, watch those. It tells you step by step. Step 1 is this is what you want. Once things are good, then you move to step 2 and this and this. And it'll show you exactly kind of what you're looking for treatment and where to find it.
Great. Here's another one. Can fascia massage be beneficial to treat PCS?
Possibly. Depends on what they're treating, what your issues are.
Okay. And then are all myofascial release, are all massage myofascial release?
Maybe. Like massage generally is like static tissue work. I find that's not as effective as actually doing kind of movement-based tissue work. So like active release, for example, you shorten a muscle, apply a tension, and then you lengthen the muscle. So if I'm working on the SCM, for example, the shortened position is if I pull my ear to my chest and I turn my head to this side, this SCM muscle, and if I turn it away and back, that's going to lengthen it. So when I'm doing work on the SCM, I shorten it as much as I can. So I bring the patient's head up to their chest, ear to the chest. I find a spot that has some tension in it. I put the pressure on it, and then I have them turn and rotate like that as I'm applying the tension. So that's more kind of like myofascial release. Whereas a massage would just kind of do this and work on that muscle. That's not going to be as effective as actually moving it through a range of motion and applying a tension.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix Program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.